Welcome to orientation for the clinical rotation for third year Drexel students. My name is Seth Patton. I'm the current clerkship director. Thank you very much for taking these students into your offices. They look forward to these experiences, and I can tell you from my experience that the time has been very positive and rewarding. You get to meet a lot of nice young students and really get to help them out. My purpose for this orientation is to give you a brief overview and to keep things brief because I know you're all busy. So the goal of the rotation is to expose third-year medical students to outpatient internal medicine. These students may be at different parts of the year. Early in the year, they're still getting used to the basics. Later in the year, they could be functioning very well and doing very well by themselves. So there will be a little bit of difference you may see between students and the time of the year. For the most part, the student is expected to see and examine patients by themselves, obviously under supervision, but it's nice to give them some time to see and interact with patients for themselves. Expect them to formulate suitable plans for common ambulatory conditions, deliver accurate verbal patient presentations, document appropriate encounter notes. In terms of schedule, the student's total rotation actually lasts 5 weeks. The clinical portion of the rotation is for half of that. The other half is an online portion that's administered by Drexel. While in the office, the student is permitted or scheduled 1 to 2 days of reading academic time. This is typically done on Wednesdays. However, this can be adjusted to the attending schedule. This time is also flexible and can be used at different times of the week, again, depending on the attending schedule, the student's schedule. The student should be encouraged to attend any resident or clinical lectures. So these could be things like morning report, grand rounds, a pharmaceutical rep, etc. And that's if available and depending on the interest of the student. It is not mandatory. The student must report any absence or illness to Drexel in which they miss clinical days. This can be made up through Drexel, but that's something that's taken very seriously. Important points about the rotation. The student should dress and behave professionally. Any unprofessional behavior should be discussed with the student and reported to the clerkship director or the student coordinator, which I will give you her information later in the presentation. Again, Drexel must excuse any absences. We're looking to avoid a shadowing experience. We're really looking for the students to get a hands-on experience. The student should focus on honing their communication and examination skills with patients. Again, getting the basic history and physical, asking the right questions, getting the 7 signs of a symptom. They should be able to present a patient case or patient encounter in a thoughtful, logical order that makes sense, that you can interpret and therefore make decisions off of if needed. They should also practice note writing and documentation. I've broken this down into half-day sessions, but I think it's reasonable that a student can examine 3 to 4 patients per half-day session. And this can be tailored to the student as well and the office. I'm hoping that the student will be able to document 1 to 2 notes during that time. They can certainly write more depending on experience and ability. Evaluations. The student will ask for feedback, specifically mid-rotation feedback. This is often done in a form which is pretty simple and pretty quick. It can be returned to the student right then and there or faxed to the student coordinator. Final evaluation forms from the attending should be submitted within 2 days at the end of the rotation. If there's any difficulty submitting these online, a paper version can be given to you or faxed to your office, which can be completed and faxed back to us for us to complete. If you have any difficulty with those evaluations, again, calling or emailing the student coordinator. Her name is Daya, and she is very responsive, excellent. Here is Daya's contact information. Again, I want to thank you for listening to this. The Orientation, this is very basic. I think all offices have a little bit of a different procedure. So, the student's experience will be tailored to your office and how you do things. Dress code, the students are permitted to wear scrubs, but I encourage them to dress similarly to the office setting that they're in. So if the attending is wearing a shirt and tie, I expect them to dress similarly. Wearing some type of identification in the form of their white coat or ID badge is also encouraged. If you have any questions, please email or call Dia Briglia, our student coordinator, and we will be happy to answer those for you. Thank you.